Recently, Dr. Oz devoted a large segment of his program to arthritis awareness. Arthritis affects millions and millions, tens of millions of people, and it is on the rapid rise as more and more people begin to cross the 50 years of age and over year mark. There are many theories about arthritis. There are many forms of arthritis. Today we're going to focus on the most common, which is osteoinflammatory arthritis. The single biggest reason for this is a lack of calcium. As we age, absorbing and transporting calcium back to the bones becomes increasingly difficult for the body to accomplish. Secondly, it's a lack of key proteins. Cartilage tissue, which is the soft spongy material that insulates your joints, preventing bone-on-bone contact, is made up of several key proteins. We can replace those proteins with things like glucosamine and chondroitin sulfate. Lastly, contributing to this problem is a lack of natural stomach acid. Now, why would that be important? Well, in order for your body to absorb calcium, it must be in an acidic state. Most calcium supplements are very alkaline. They're essentially ground up rocks. In order for your body to utilize the calcium from those supplements, and even from some foods, the stomach has to be acidic enough to lower the pH to an acidic level of 5.0 or lower. And when we get 50 years of age and older, that becomes much more difficult. For this reason, at our research center, we find it is simply much safer and much more effective to use supplementation to guarantee that we have the right combination of nutrients, the right acid-alkaline balance, and the right proteins. We have developed 3 formulas that we use for this. Our first one is our calcium formula. The calcium formula that we use is the only formula that has been proven in 7 clinical studies to actually increase bone density over time, not simply slow it down. And that formula contains chelated calcium, chelated magnesium, and a variety of trace minerals essential for this job. Next, we use a formula we developed called Joint Flow. Joint Flow provides the glucosamine and chondroitin proteins necessary for the body to rebuild cartilage tissue. Then we have a very unique formula. It is a formula designed to be a natural anti-inflammatory, because when inflammation sets in the joint, that's when deterioration of cartilage tissue and connective tissue increases. So if we can find a way to naturally control inflammation in the joint area, we can slow down the progression of deterioration while we rebuild the joint with proper proteins and proper calcium. These formulas are available through a company in Southern California called Phoenix Nutritionals. You can access their information in the description below this video. Keep in mind that there are points of no return. If the joint is so severely damaged, it may eventually require joint replacement. So the time to act is before those things happen. I'm Dr. Whiting. Thanks for listening.